Which one of the following pulses is based on Frank-Starling law? So very important question. It is pulsus alternus, alternans. Alternating, you can see here, alternating pulse of high and low amplitude, again high and low. It is showing Frank-Starling law. So first let me revise what is Frank-Starling law. If you remember, a stroke volume or force of contraction is proportional to the end diastolic volume. Under physiological limit, end diastolic volume is actually the preload. What is the preload? Amount of blood in the heart before contraction. Amount of blood in the heart before contraction is called as preload or end diastolic volume. Amount of blood in the left ventricle after the diastole or before the contraction is called as end diastolic volume. So more is the preload, more will be the force of contraction. So more is the preload, more is going to be the force of contraction. This is called as Frank-Starling law. Under physiological limit, after that it will not be followed. This is very important. So you must remember that force of contraction is proportional to end diastolic volume. Now whenever there is left ventricular failure, left ventricle will fail. So whenever there is failure of left ventricle, what will happen? Force of contraction will be less. So that will cause less amount of blood to go from ventricle in the aorta. So more blood will be in the ventricle after the contraction. So end diastolic volume will increase. Preload will increase because ventricle failure is there. Ventricles are not able to pump the blood in the aorta, and when ventricles are not able to pump the blood in the aorta, more and more blood will be, backlog will be there. Backlog will be there, and that will produce stretch on the ventricle, producing more force of contraction. So alternating, this will be weak pulse, that will be strong pulse. Weak pulse, strong pulse. So weak pulse will produce a backlog of blood in the left ventricle, producing more and more end diastolic volume, causing stretch in the left ventricle, and that is going to increase force of contraction. So like that, first there will be weaker pulse, then will be the stronger pulse. It is called as pulsus alternans, found in left ventricular failure, and this is proving what? Frank-Starling law.